This oral powder is used to relieve constipation by increasing the bulk in your stool, which helps to promote movement of the intestines. It also adds water to the stool, making it softer and easier to pass. In addition to treating constipation, this medication, which contains psyllium, can also be used with a proper diet to help lower high cholesterol levels. It is recommended to take this medication with plenty of water and to follow the dosage instructions provided by your healthcare professional. Taking this medication at the same time each day can help establish a routine and improve its effectiveness. When taking Konsyl Daily Fiber, Stevia, 3.5 gram/5.8 gram oral powder bulk laxatives, be sure to follow the directions provided by your doctor or on the product package. To prevent choking, it's important to take this medication with a full glass of water or other liquid. If you're using the powder form, be sure to measure each dose according to the product label, mix it with a full glass of liquid, and drink it right away. You may need to add more liquid if the mixture becomes too thick. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take it more often than directed. Also, be aware that this product may decrease the absorption of other medications you may be taking, so be sure to take it at least 2 hours apart from your other medications. It may take 1 to 3 days before you start to see the effects of this medication, so it's important to use it regularly to get the most benefit. Try to take it at the same time each day to help you remember. And remember, do not take this medication for more than 7 days unless directed by your doctor. If your condition persists or worsens, or if you experience rectal bleeding, be sure to inform your doctor. And if you suspect a serious medical problem, seek medical help right away. Gas or stomach cramping may occur, but these effects should not last long. If they do, it's important to talk to your doctor or pharmacist. If your doctor has recommended this product, it's because they believe the benefits outweigh the risks of any potential side effects. Most people who use this medication do not experience any serious side effects. It's essential to take this product with at least a full glass of water or another liquid to prevent it from swelling in your throat and causing choking. Seek medical help immediately if you experience symptoms of choking, such as chest pain, vomiting, or difficulty swallowing or breathing, after taking this product. While a severe allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms such as rash, itching, swelling, particularly of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other unusual effects, it's important to contact your doctor or pharmacist. In the U.S., you can also call the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch to report any side effects. In Canada, you can call Health Canada at 1-866-234-2345 to report any side effects. Before taking Konsyl Daily Fiber, Stevia, 3.5 gram/5.8 gram oral powder bulk laxatives, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Also, discuss your medical history with your doctor, especially if you have stomach or intestinal blockage, difficulty swallowing, appendicitis, a sudden change in bowel habits, or if you are diabetic or have phenylketonuria. If you are pregnant or breastfeeding, consult your doctor before using this medication. And before having surgery, be sure to inform your doctor or dentist about all the products you are using. When taking Konsyl Daily Fiber, Stevia, oral powder bulk laxatives, it's important to be aware of potential drug interactions. These interactions could impact how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to keep all medical and lab appointments to ensure the best results from using Konsyl Daily Fiber. In addition to taking the medication, making lifestyle changes such as exercising, drinking enough water, and eating a proper diet with fiber-rich foods like bran, fresh fruits, and vegetables can help prevent or relieve constipation. It's recommended to talk to your doctor or pharmacist about lifestyle changes that might benefit you. Remember to always follow the recommended daily dosage and take the medication at the optimal timing for the best results. If you happen to forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. Each brand of Konsyl Daily Fiber, Stevia, 3.5 gram/5.8 gram oral powder bulk laxatives may have specific storage requirements, so be sure to check the product package or ask your pharmacist for instructions. It's important to keep all medications out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless directed. Be sure to properly discard this product when it reaches its expiration date or when it is no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.